Hysteroscopy is a tool that we use to evaluate the uterine cavity. The hysteroscopy instrument is a camera that we place through the cervix to look directly into the uterine cavity. The hysteroscope can be used to see the uterine cavity. That would be a diagnostic hysteroscopy. It can also be used to remove or improve any problems of the uterine cavity. There are a few things that we look for in the uterine cavity. One is the presence of any abnormalities of the surface of the uterine cavity. These abnormalities can include uterine fibroids, endometrial polyps, adhesions of the uterus, which are scars or scar tissue in the uterine cavity. We also can evaluate the shape of the uterine cavity, and if we do see any of those problems, we can use the hysteroscope with instruments to operate inside the uterine cavity and either remove or fix any of those problems. Diagnostic hysteroscopy is generally done as an office procedure. This is not done under anesthesia. Most patients find it extremely tolerable. We place a small amount of saline into the uterine cavity and then place the flexible office hysteroscope into the uterine cavity to visualize the contents and the surface of the uterine cavity. When we find that there are abnormalities of the uterine cavity that need to be repaired or removed, we perform operative hysteroscopy under general anesthesia in a hospital same-day surgery setting. Hysteroscopy does not require incisions on the abdomen or any instrumentation of the intra-abdominal cavity, and it does not require a lengthy recovery time.